New federal legislation would regulate an industry fact finder 12 is examined. Senator Jerry Moran of Kansas, one of the sponsors of this bipartisan piece of legislation. As we first told you last month, independent pharmacies in the state say pharmacy benefit managers are controlling the market and raising real questions about whether they can even keep their doors open. Sean Logging has this follow-up to our fact finder and what a patient says about the importance of her local pharmacy.
Mike, PBMs are the middlemen negotiating what you pay for a drug between the drug maker, insurance, and pharmacy. They've amassed significant power in the healthcare space. Federal lawmakers tell me that they've just introduced legislation that would provide greater transparency of PBM practices and help with high drug costs.
I feel like they're friends. I don't feel like they're just a pharmacist. I feel they just come across that way.
Urvetta Ferry is a loyal customer of El Dorado True Care Pharmacy.
They want to take care of their patients or the medical staff that they're working with.
Even with a move to Wichita a year ago, it's her pharmacy.
They mail them to me if I don't happen to be in El Dorado.
Urvetta has a lot of experience working with pharmacies as a healthcare provider before retiring 10 years ago. She says her experience working with independent and local pharmacies was a better relationship. That's why she's among the patients to submit a letter. Pharmacists took to Topeka during their advocacy day earlier this month, urging reforms around pharmacy benefit managers.
Kansas and the United States have to do something about keeping those independent pharmacies. There's so many small towns that maybe just have an independent pharmacy.
The three largest PBMs account for 80% of the market. El Dorado True Care's owner says that leaves businesses like his with little power to negotiate.
They divert as much business to themselves as they can, and they're not required to pay themselves the same as they pay us. In fact, it's a lot more.
Now, federal lawmakers, including Senator Jerry Moran of Kansas, have reintroduced the Pharmacy Benefit Manager Transparency Act. It would ban deceptive and unfair pricing schemes, prohibit arbitrary clawbacks of payments to pharmacies, and require PBMs to report to the Federal Trade Commission on how much money they made through spread pricing and pharmacy fees.
Far enough in my profession that I can help our pharmacy stay open for one more year, but how many more years can I do that?
Finding a way to keep independent pharmacies open is what Urvetta wants to see. Now, that federal bill has been previously introduced. The association representing PBMs has said that it would hinder their businesses and expand the FTC's authority. Now, there were efforts to introduce legislation on the state level here in Kansas, but those didn't pan out. But they hope to do so again next year with another attempt.